Well, welcome. I'm Dázon Dixon Diallo, and I'm founder and president of SisterLove Incorporated. I'm also the convener and the creator of Women Now. Women Now is a global summit on the intersections of HIV and sexual and reproductive health, rights, and justice in the lives of women and girls of African descent worldwide. I am so excited for this conversation with my besties. I'm talking about BBBFF. You know what I mean? Yes, my beautiful black best friend forever and ever and ever, Loretta J. Ross. Welcome to what is this? Women Now We Talking.
Thank you, Dázon. I'm so excited about Women Now. I've tried to support you as much as I can, and this looks like might be my first time actually attending one.
It's going to be awesome. And just for people to know, because I'm going to say it now and we'll say it over and over, that we know that we're in a new time and that even as we still are dealing with the pandemic of, these things, they do what they want to do. So that even as we're dealing with the pandemic, of course, the coronavirus is still upon us and still devastating lots of communities and lives and families, and in some instances, countries, that we know that we live in a dual a dual dimension now, where we're in reality and we're in virtuality. And so we're excited that Women Now this year, for people who may not be able to travel to where we're going to be this year, they actually are going to be able to join us virtually this year for Women Now. So I'm excited. And not only that, we'll have opportunities for people to join us throughout the year. And that is the other exciting part about this conversation. So let's just get this going with why we're even doing this. We can talk a little bit more about Women Now, but I want to just dial it back a little bit and bring it all the way to sexual and reproductive health, rights, and justice. I want us to go all in on starting from the end backwards. And I say that because we've spent many, many decades, obviously, even from the time that we organized in 1994 in Cairo for the International Conference on Population and Development, right?
What's up with OJ?
What's up with OJ and other issues of domestic violence and women of color in the lives of women of color. That was awesome. But there's this thing, though, is that we are now bringing these conversations forward in a more intersectional way. And coming out of Cairo, coming out of the Fourth World Conference on Women in Beijing, we recognized then that as for a lot of people who were not necessarily at the table crafting the framework and being able to put the language in the documents that were adopted by the UN bodies that were relevant to the conversations, that not all of our issues were being covered. And even now, I still say, and I have said it out loud, that by the mere fact of excluding HIV, for example, from the program of action from the International Conference on Population and Development, that set us at least a decade, if not 2 decades behind in addressing HIV and AIDS from a reproductive health and rights perspective in the way that it should be. And so that was one of our conversations way back then. And in that same year, there was another conversation that came along that, and I'm talking now about where we even came from on reproductive justice and how we got to reproductive justice and why this meeting with Women Now is centered around reproductive justice as an expansion or as a transformation of the framing of sexual and reproductive health and rights. Can you tell us about how we got to that?
Well, I probably want to back up at least another decade because the UN had declared the World Decade for Women from 1976 to 1985. And too many countries were adamant that we couldn't include sexual rights in the plan of action. So if you fast forward 9 years to Cairo, we'd finally gotten a global conversation around sexual rights, like the right to determine if and when you'll have sex, if you're going to marry, if you're going to have children, the right to use birth control, abortion, and all of those things. So there had become a global conversation around sexual rights by the time we got to Cairo in 1994. But 3 months before we went to Cairo, a group of Black women were at a conference in Chicago hosted by the Pro-Choice Alliance of Illinois. And we heard this presentation by the Clinton administration trying to reform healthcare reform. And somehow these centrist Democrats thought if they omitted any reference to reproductive health care, triggering people's concerns around abortion and birth control, that they could somehow get it past a Republican-controlled Congress.
Mm-hmm.
And of course, that sounded like a very shaky strategy to we 12 Black women who were listening to that, because in our analysis, reproductive health care is the main reason women first go to the doctor. It's the reason we most go to the doctor. And so if you're going to omit reproductive health care from healthcare reform, basically you're preparing a very male-centric plan, and then you're coming to a feminist conference and asking us to support that.
Mm-hmm.
And that strategy just didn't make sense to us. And so I believe it was Abel Mabel Thomas that had us meet in her hotel room that night,
Mm-hmm.
who was then a state representative, if I'm not mistaken, and talking about what we were going to do. And we decided to take out a full page ad in the Washington Post and in the roll call so that Congress could hear from us to get their attention. And what we also talked about in that hotel room was how abortion rights was always separated from all the social justice issues that really determine whether a person keeps a planned or unplanned pregnancy. Because if you don't have access to housing, if you don't have access to health care, if you're afraid that your partner will beat you, if you tell them that you're pregnant, all of these other social justice, what we call now intersectional issues, really affect people's reproductive decision making. Because if you don't have health care, if you don't have housing, if you fear violence or dropping out of school or losing your job, even a planned pregnancy may turn into abortion because you have all those bad answers. But if you have good answers to those social justice or what we call human rights issues, then an unplanned pregnancy will turn into a baby in most instances. And so we spliced together the concept of reproductive rights and social justice and coined the term reproductive justice in that hotel room. And that was what we were going to use to take out our signature ad in the Washington Post, Women of African Descent for Reproductive Justice. But the Black Women's Health Imperative was our fiscal sponsor, and they were organizing our press conference at the National Press Club with Maxine Waters. And so, and they advised that we probably should call ourselves Black Women for Healthcare Reform, because nobody really understood what reproductive justice was at the time. But we were clear that we were going to at least speak to Congress about what we wanted from healthcare reform. And then when SisterSong was organized 3 years later in 1997, we started talking about reproductive justice as a framework amongst ourselves. And I remember, very interestingly, Alice Skinador from Green Bay, Wisconsin, an indigenous midwife, came to me and put her hands on her hip and she said, "Loretta, exactly what is this reproductive justice we keep talking about?" And I looked at Alice and I was like calculating in my head, now how do I give this to Alice? Because Alice was one of our pro-life members and founders of SisterSong. So I had to give an answer that would fit the pro-life framework as well as the pro-choice framework.
Right.
I said, "Well, Alice, you agree with me that every woman should be able to have the babies that she wants to have, because you're a midwife and you catch those babies. And you agree with me that many women of color are subjected to population control strategies, right?" I said, "So the first tenet of reproductive justice is to have the children that you want to have."
Correct.
But I said, because you're a midwife, though, you know that everybody doesn't want to have every pregnancy end up in a baby, right? And so we have the human right not to have the children we want in the way we want to not have them, right? That means abortion and birth control and abstinence. And Alice just shook her head and said, "Yeah, I guess so." I said, "And Alice, if you agree with those two things, will you agree with me that neither the pro-life or the pro-choice people talk about what happens when the baby once it's here?"
Right.
And so we talk about the third tenet of reproductive justice is the right to raise our children in safe and healthy environments. And Alice just beamed all over herself. She said, "Oh, no, I get it. The right to have a child, the right not to have a child, the right to raise your kid. I got this. I like reproductive justice. And so after that conversation, it just took off. We created it, we Black women created it as a way to talk about human rights. And particularly once we went to Cairo 3 months later and saw that the entire global South was using the human rights framework in the way we were talking about.
So I want to stop right there and dial it back a little, one more time to bring it in to why we hold women now and are specific in engaging HIV as a part of that intersectionality. And that's because at the same time that those conversations were happening, just even a few years prior to that, SisterLove had started in 1989. One of the big fights that we have been involved in for over 4 years, from 1990 to 1994, was in making sure that in the United States, that the guidelines that were used to identify or diagnose people with AIDS, that were then also being used as a way to determine who should be able to get social benefits or safety, social net entitlements or access to benefits in healthcare or housing or in social support or in mental health support or substance use, that there were so many things, or there were a few things that women were experiencing that were not on that list of opportunistic infections, that if you had an HIV positive test result, but you didn't have these particular opportunistic infections, you did not get an AIDS diagnosis. Some of that included very gender specific issues. Was it because
they mostly were focusing on men?
Well, absolutely. So if you think about what era we're talking about, when the AIDS epidemic first came to light, it was predominantly, now we know it was popping everywhere. It was popping in the late 70s, actually, where there are even women and there are people of color and Black people that I know who have had AIDS since the beginning of the epidemic, 1981 in the United States. But for the sake of the history of it, the epidemic was predominantly identified in white men and in white men who were, for the most part, having sex with men or were bisexual. And so there was this exclusion by ignorance, really, but also by not including other people in the science. Like, well, maybe other people might be experiencing this. Didn't necessarily come to mind until the activism brought it to mind. We even had to convince ACT UP, which was the premier, I mean, the in-your-face, almost sort of multicultural organization that was a fierce activist organized by mostly gay and lesbian, bisexual, and transgender people across this country to have access to treatment, to advance the research, to speed it up, to make it better, to save lives, because people were dying very rapidly. The thing is that there were also women who were dying, but not receiving those benefits before they passed away.
Was it particularly Black women?
It was particularly Black women, but let's say it was particularly poor women, poor women of color, Black and brown women, women who were rural, who, if they had cervical cancer and had an HIV diagnosis, for example, they were not eligible because that did not get them an AIDS diagnosis. So we had to do that fight. But in addition to all of those kinds of things, there were women that when they were getting pregnant, they were being shamed, or they were being coerced into abortions, or they were being shamed for having sex because they were seen as vectors of disease, or they were being told not to get pregnant at all.
Weren't there forced sterilizations in there?
There were forced sterilizations, and let's not put it in the past tense. There are forced sterilizations that are still going on. We'll be talking about that this year with Women Now, because we know there are groups of women who are mobilizing around forced sterilization for people living with HIV. So bottom line is that especially for Black women in those days living with HIV, housing was critical because of discrimination. People were being kicked out of their homes because of HIV. Their children were being taken away from them. They were losing their parental rights because of people's ignorance around AIDS. If they had to even go into the hospital, for example, and there was no one else to take care of their children. And so they voluntarily asked the state to be the ward for their children while they were in the hospital. It might have been up to a DFACS worker, a Department of Family and Children Services worker, to come back and say, well, you know what, you're going to die anyway, so we're not going to restore your parental rights.
Oh my goodness.
That's the kind of stuff that was going on, right? And not to mention the fact that we already knew that the violence against women had this double edge to it, that if you were living with HIV, the violence was likely to escalate. And if you were already in a violent situation, you were more likely to have HIV because of the risks that an abusive partner would also pose. So here we were in the HIV world without a framework for how to address these reproductive health and rights issues. But when we're over here in the reproductive health and rights world, there was no framework for how to address HIV and AIDS.
Right.
And so when we came back from Cairo in '94, when we learned about what had happened in Chicago, we were like, that's it. And so we started organizing differently when it came time to bring HIV/AIDS to the conversation in Beijing a year later in Wairo. And we got there and we had this, we showed what it looks like when you integrate HIV. We had sessions on domestic violence. We had sessions on lesbians living with HIV. We had sessions bringing different Black women living with HIV all over the world together to talk about the commonalities and the differences. And so we didn't even think about things like the increased risks of HIV for women who were subjected to female genital mutilation, or for women who were, or girls who were sold into marriages, or, you know, what they call childhood marriages, which I call, you know, intergenerational sexual slavery. But there were all of these other issues that still were not being addressed at the intersection of HIV and reproductive health and rights, and a whole lot of other stuff, inclusion in the research, getting access to services, making sure that our whole selves were being addressed, and doing it within the human rights framework. Finding about reproductive justice just sort of, you know how you get that lock to just clinch things together? Right. Well, that's what happened for us. And that's why being a part of SisterSong was important. I think for this conversation, what's important also for our story in this is that by being involved in HIV and AIDS and in sexual and reproductive health and rights in the United States in the late 80s, there weren't a whole lot of other organizations that were doing this intersectional work like us. And so where are we going to find that was outside of our country. So it was imperative for us to get to these international meetings where people were like, well, you don't do this work, you do AIDS work. And there's an AIDS conference for that. And I was like, and you get to the AIDS conference, it's like, well, that's reproductive rights work. So that had to stop. And that's why we took the opportunity to start bringing delegations that weren't all about HIV together. Right. So if you advance that to where we are now, and you know, SisterLove formed, we were a part of forming SisterSong. We have been a part of the conversation on reproductive justice, and that has been predominantly domestic in the US. But here's the thing, no matter where you go in the world, doesn't matter what percentage of the population Black women are, we are currently and have always from the beginning of this epidemic been bearing the burden of the epidemic in disproportionate numbers. Now, the continent of Africa, quite obviously, because it's African women, but African women as a whole on the continent are disproportionately representing the burden of the epidemic among women around the world. But if you're in Europe, if you're in Asia, if you're in South or Central America, if you're in North America, where women, for example, Black women are roughly about 6% of the whole population in this country, but we're almost 60% of all of the HIV/AIDS in this country, right? And it sort of sounds like that no matter where you go, where even we're maybe 1 or 2% of a population, we're still 30 and 40% of the HIV epidemic. So the question has to be why? What is that? And we want to say we know some of that. It's racism. Some of it's classism, some of it's xenophobia, some of it is still about homophobia and transphobia, and some of it is just really about the cultural aspects of how we're dealing with HIV from a stigma standpoint, from an access to healthcare standpoint, but also at the root of it all, how we're identifying the unique experiences that are sexual health and reproductive health and rights and equity oriented for women of African descent. The International AIDS Conference has been going on now for, I think we've had our 19th, or I don't even remember how many. We'll edit in the right number. But it's been a lot of them, right, since the late 80s. And it was in 2016 and let me back up and say that we put together a fabulous delegation when the International AIDS Conference, which is a big global meeting, for the first time went to Africa, and it went to South Africa. And it was in a watershed year in the year 2000, because that was about 4 years in when we finally had these cocktails, right? For people living with HIV, we had finally found these drugs. There was treatment that was saving people's lives, that was elongating people's lives and improving quality of life. And there were lots of people around the world who didn't have access at all. Same kind of conversation we're having right now about coronavirus and the vaccine and the testing and the measures that are available.
They're calling it vaccine apartheid.
It was the exact same thing with HIV treatment, right? And so 2000 was a watershed because you had the birth of the Treatment Action Campaign, you had ACT UP, you had Treatment Action Group, you had ACT UP Parish, you had all of these different groups of people living with HIV and AIDS saying, this time is up. You have to provide treatment to everybody because it's life-saving and you owe that. And so it was a huge movement. We were a part of that as well. And that's where we grew beyond the friendships we had made in China and in Cairo with people like Prudence Mabele and her organization, Positive Women's Network. Well. Oh, the International Women in Health meetings. Absolutely. The Uganda trip, the Manila trip, if you remember those, that at each one we were building on this conversation of how you intersect HIV and sexual and reproductive health and rights. And now by the year 2016, when the International AIDS Conference was returning to Durban in South Africa, we looked up and we said, you know what? They have pre-conferences for just about every population, about every issue, except women. And more importantly, there are a whole lot of workshops, there are a whole lot of scientific presentations about women of African descent, but there's no meeting about us. There's no inclusion of us in those conversations.
And experts on our own lives.
And exactly, there's certainly no recognition of our experts, our researchers, our community leaders, our women living with HIV, folks who were activists and advocates, people who were journalists and writers, artists even, who were engaging communities around these issues. And so we said, well, we could sit around and we could wait for one of these big organizations to finally think about us, or we can have our own meeting. And by having our own meeting, we can now define it the way we want it to be for us. Because as they say, you know, African problems will be solved with African solutions. And so African women's problems, even more so, because we're usually the solvers of all those solutions, right? So that's how Women Now was born. Was in 2016, we said, we're going back to Durban, but this time we're going up front. We're going in a leadership role. And we held the first Women Now, and it was phenomenal.
I saw the pictures. I was so jealous. But I have one question for you.
Yeah.
Because in addition to the reproductive justice framework, you always talked about sexual rights and reproductive justice.
Absolutely.
That's the discourse at the global level. Could you explain to me more about that?
Sure. So because, well, I'm going to start with the fact that I'm also literal. So when you're talking about reproductive justice, and it ends up being this way, right? Until people get a real full understanding of the total framework of reproductive justice, they still want to box it in around issues of reproduction, around access to abortion and contraception and all of that, which is the core, it's the essence in terms of power and control. But there are so many other issues that are related to that, which fall within our sexuality and how we live our sexual lives. Practicing safer sex, right, doesn't have to be an issue around reproduction or protecting your children or choosing when and when not to have a child. It's about stopping a virus, right? And so how do you have that kind of conversation in the same way that we want to identify being able to have the rights and equity around abortion, around contraception? We want tools for women's prevention. We want to make sure that women living with HIV have the tools they need to have children safely. And the fact that looking at how women with HIV are even able to have sex safely and with pleasure, but also to have the children that they want to have, that there are other issues around our sex and sexuality. There are issues, for example, of gender-based violence, which is usually also encapsulated in sexual assault, which is an issue around HIV. but it's also connected, right? So expanding on sexuality, and it's also because it doesn't always have to be, as some of our young people say, womb centric, because that then allows us to make sure that we're engaging with our trans folks, with our transgender community. It makes sure that we're engaging with folks who don't have uteruses that are able to produce, right?
Yeah.
So there's all kinds of ways that we want to be able to bring sex and sexuality and the rights and the equity and the dignity as a human right to sex and to sexual identity and sexual expression and all of that, as much as we want to make sure that our reproductive health and our rights and the framework to make sure that it's all equitable and just all work together. Because that's the only way I think we're going to get to the end of the epidemic. It's the only way we're going to get to the end of gender-based violence. It's the only way we're going to even get to the end of discriminating against folks around who gets access to which kinds of contraceptions, when, where, and how, and who pays for it, right?
So what kind of intersection are you going to see when you have these two pandemics meeting each other, HIV and COVID?
You know, it's very interesting because some of the intersections haven't changed. When we're talking about looking at HIV and COVID, there's still questions around who's being included in the research, right? Right now, there's not even though we have at least 2, maybe more, effective vaccines that are coming to market that are already going into people's bodies that are not yet usable for people who are pregnant or for pregnant women, right? And a large part of that is because a lot of pregnant women were not included in the studies. It's not long enough yet to know the impacts because you actually have to follow somebody for at least 9 months.
I think a couple of women became pregnant while they were in the study.
Yes.
But they don't, that's a very small sample.
It's a very small sample. And let me tell you something. It's because of the fight for inclusion of pregnant women in studies, because pregnant women have agency as well, that they were able to stay in some of those studies. Because a lot of studies, you fall pregnant, they kick you out, right? Or you have to agree to be on a long-acting reversible contraceptive in order to stay in a study. So there's all kinds of discriminations around that, but there are also issues in terms of the COVID response that are very much connected to HIV. The slowing down of access to prevention, to testing, to treatment. There have been stockouts in a lot of places around the world where, because of the response to COVID and the lockdown because of that people's HIV medications were shut off. There are folks for whom their reproductive health services were not considered essential health care. And so during the lockdown, essential health services excluded reproductive health unless you were in labor and delivery. There were even folks, for example, who are sex workers for whom having access to these services is critical. And in the era of COVID lockdown in a lot of places, even where sex work may be not necessarily criminalized, but decriminalized, that work was not seen as essential work. And so they could not work. They did not have access because they cannot have access to all of the same kinds of social supports and services that other people have. So, and for a lot of people, especially women and children, going to work and going to school is safer for them than being at home. And in a lockdown where they're already subject to gender-based violence or children or abuse of children, then this was also increased. And so all of these issues become reproductive justice issues. And I don't want to just leave it to just talking about what happened with COVID. There's issues around racial justice that are also intertwined and intersected with reproductive justice. And so that's why, bringing it back around to why we want to talk about what are some of our major common issues for women of African descent, no matter where we are in the world, what are our common issues and what are some of our common solutions that we think we can implement wherever we are, individually and collectively, so that we can impact the change, that we have to impact the change.
So obviously we have to talk about white supremacy and neoliberal capitalism. I mean,
we have to talk
big
about
words.
Yeah, we have to talk about. Well, and I'm glad you raised that, because we have to talk about capitalism, neoliberal capitalism. We have to talk about immigration policies that aren't serving us. And in a lot of instances, we have to talk about the disunity among Black women around the world and how not creating these spaces intentionally is keeping us in these isolated silos. The thing when you talk about bringing in the white supremacy and the issues around patriarchy are so critical because our young women see it. They see it, they understand it. They don't mind using the words like disruption and dismantling. And those are the kinds of conversations we also want to keep fresh in the meetings that we hold with Women Now. The other thing that I love about what we do with Women Now is we organize the meeting the way we tend to have meetings in our own communities, right?
What does that mean?
So what it means, for example, is when we have a problem in our neighborhoods, we don't immediately think about going and renting a big old hotel room and gathering a few experts.
Sure enough, don't want to call the police.
We aren't going to call the police, but we aren't going to go get a big meeting room and call on a few experts that don't live in our communities to come and tell us what the problems are, and then to give us 10 minutes to ask them a few questions about it and then go to another session. You know, that's not how we solve problems. What we do is we talk about some of these big problems, and then we start spreading the word about them to see what everybody is saying about them. And then we come into these smaller places like around our kitchen tables, or sometimes when we're doing our crafting together, when we're doing our market work together, or in our organizations together, right, that we're sitting around tables talking like, you know, we're having conversations. We're not going through, you know, checking off bullets. Women Now, the last couple of meetings we've had with Women Now, we've had whole productive meetings with no PowerPoints. Go figure how that works.
I would love to go to a conference with no PowerPoint.
Exactly. Can you imagine? And that when it's with each major topic, gender-based violence, equity and research, capitalism, we've talked about issues around access to treatment and care. We've talked about peers and how women's voices are heard in political spaces and social spaces.
Tell me about youth, because y'all seem to have a big emphasis on
Oh,
youth.
man. What we do is we also make sure that we are intergenerational. So we have young people on the planning committee who are helping us plan the whole big meeting, but they're also on a youth committee planning a separate meeting. And when I say separate, it's not segregated. It's just that they have
parallel.
It's parallel and it's intertwined because we all participate in the big conversations. And then with the same topics, they form their own types of sessions and how they hold their conversations simultaneously. And then we join up for the big conversations at different parts of the day. We also do something that I call immersive conference experiences, right? So we want to make sure that when meetings go to a city or to a country, that we're not just going there because that's the place to go. Right. We're going there because there's something that women are doing there that we can learn from, right? And so we make sure that a large part of our organizing is localized, that a lot of the issues are centralized in what's happening locally, but we also get involved locally. We want to know, what does the women's community look like? What's a regular day for a woman in this city? And what can we learn from that? We make sure that we recognize the women leaders in that country who have been battling around HIV and sexual and reproductive health rights and justice the same way we honor women here in the US. And we also, we have incorporated getting directly involved in the community. Like, is there something that we can go and do alongside and with?
That's why y'all are in the streets marching at the same time y'all are conferencing.
Exactly. And making sure that we're intertwining arts and culture so that we are telling our stories in all the ways that Black folk tell our stories.
Now, I need to ask you, there are some activities that are leading up to the big conference, December 3rd through 5th this year in Botswana. So why don't you tell me about all the preparatory work that's happening?
So, you know, in the past, because we work to organize, we have a Pan-African partner that organizes across the continent. That's the Pan-African Positive Women's Coalition. We have worked with other organizations that are transnational and on the continent and intercontinental. We have, or intra, we have, and so every single time we've been organizing, there's been this ask of us to have a way for local communities within countries or within regions to hold some conversations before we get to this big meeting, because not everybody's going to be able to get to the big meeting, but we're supposed to represent what's going on in our communities. So I am so excited that with some of the energy from the UNFPA and from other organizations like the United Nations Population Fund, that we are also partnered up with the Global Fund for Women. And there are so many other partners that are coming on board, and we'll be updating you along the way, that this year we are identified about 8 regions around the world where we're going to be holding these Women Now conversations on those issues of intersecting HIV and sexual reproductive health rights and justice for women of African descent in that region. So whether it's North America.
So you're building momentum leading up to Botswana.
Absolutely. And the issues that are coming out of those conversations are creating the agenda and the subject matter for that meeting. And I think it's important for folks to understand that it's important to be involved in both, right? And because we're going to, in both, meaning the regional meetings and the main meeting, because there's going to be lots of different voices that you're not going to all be able to hear in that one gathering.
That raises a question. Okay, I'm an activist.
Mm-hmm.
I'm also maybe working in public health, or I may be teaching or something. How in the world do I get to Botswana? What can Women Now do to help me out?
You know, I was kind of holding it up, but I'm glad you said it. So let me just back it up and say this year, and just to excite folks, Women Now has been in Durban, South Africa. We have been in Amsterdam in the Netherlands. We've had smaller meetings in Côte d'Ivoire, in Abidjan. We had a fantastic meeting in Kigali in Rwanda in 2019. And this year, we'll be having our meeting in Gaborone, Botswana, which is in Southern Africa, just above South Africa, between Namibia and Zambia. And we're very excited about that because our Pan-African partner, the chairperson, is based in Botswana. So our Pan-African partner is going to be—
That's about 4 hours north by car from Johannesburg.
It's a 4-hour drive from Johannesburg to Gaborone. So most people, you're going to fly into Joburg anyway. And probably if you don't drive up, if we don't even have shuttles, who knows? You just gave me a great idea, because on the way up, if people want to come in early, on the way up between Johannesburg and Gaborone, you can go through Rustenburg, you can go through Pilanesberg, which is a big national park with the national wildlife. I was going to get to that.
Sun City's on the route.
You can stop at Sun City, and I'm going to tell you, Sun City is an amazing—
Will not play in Sun City. Remember we had that song?
You'll never play in Sun City.
Fighting apartheid. Right.
And then I went, and one time I remember seeing John Legend play in Sun City, of course, long into the New South Africa. And that was a phenomenal experience. But I think being in Gaborone in Botswana is going to be really important, because Botswana is a middle income country. Botswana has had a very proactive, if you will, especially through their previous couple of president, couple of administrations ago under Augustus Mugai, where there was a very proactive and progressive approach to prevention, to using condoms, to making sure that women and girls were included, that there were intersections around gender-based violence and HIV, around community development, around women's economic development and equity. So there are all of these different approaches, and it's going to be important to learn from them, and also to learn from what their ongoing challenges and struggles are, and how they have begun to answer these issues between HIV and COVID and sexual and reproductive health rights and justice. So that's going to be really exciting. But these virtual meetings are also— so if you're the activist, right, getting to Botswana is about a couple of things. Like, for some of us, you do the work, we get you there. So we have a very robust organizing tool that we're using. There are meetings. Zoom is one of them, or helping organize the regional meetings, as well as the big meeting that's taking place in December of 2021. That's December 3rd through the 5th, which is just prior to the International Conference on AIDS and STIs in Africa. But we are raising money as we speak to make sure that we can scholarship people. So I want you to stay tuned and stay stay abreast of what's happening on the website at womennow.world. You can follow us on all the socials, on Instagram and on Twitter and on Facebook and on TikTok even, to stay in tune when the scholarships are available, if and when we're going to be calling for folks to do or give different workshops or different sessions. But we may actually be looking for folks to just answer some specific questions to help us reach the right program that people want to see and want to happen. We've got a few surprises up our sleeve as well. So I'm gonna just keep that to myself right now. And I'm an Aries, so you know that's hard for me to do. But we're gonna keep some of these really cool, sneaky pieces to ourselves, because it's also what makes us so unique. And it also brings us so much closer together. I can tell you that there are women who, on a voluntary basis, have been helping us plan Women Now since 2015. And they are still here. And when we put out the call just a week ago to say, we're ready, we're gearing up, people came in droves. We're gonna see testimonies from folks who've been to meetings before. And you're gonna be hearing from a lot of folks, because we got a load of people who are gonna have their hands on making this happen.
Oh, it sounds very, very exciting. I would say that as an activist who's been doing this for better part of 50 years, that there'd been a big drop off in transnational organizing in the 21st century.
Yes.
It really is not like the 70s, the 80s, and the 90s
It's
when
not.
we were building these bonds within the diaspora, but now we're having to rebuild these networks and rebuild these bonds. And so thank y'all.
Well, I take this approach that, first of all, we have to understand the connectivity of why we're experiencing both of these pandemics at the highest levels in all of our communities, no matter where we are. And that a lot of those reasons are issues that only we are suited to resolve or to solve with the right resources, with the right leadership, with the right access, that we are the ones. But there's another thing that I truly believe, and that is, as we started this conversation, recognizing that, and I say this in truth, is that a lot of times I'm actually grateful that the epidemic of HIV started predominantly, or was identified at least predominantly, in white men in America, because it was identified in people with the highest of privilege in terms of security with work, security with their rights, access to health care, the opportunity to give voice, to be angry, to take to the streets, to call, government to task, that, their issues were responded to. And especially since they were able to identify as people who are also in the margins, as white men who happen to be gay and bisexual. So they understood the oppressions that they were living under, even with the privileges that they had. So I always say that I'm grateful that it happened, that we recognized it for them first, even though that we had some detriment in trying to catch up with identifying other populations. But I say this all the time, is that if it had happened first in Black people who were injecting drugs, we still be talking about, ooh, them poor Black people just dying disease. There would be no billions of dollars. There wouldn't be a whole global, force doing the research, trying to find the cure, the global fund itself wouldn't exist, I believe. I truly believe this.
Global fund for AIDS.
The global fund for HIV, AIDS, TB, and malaria, right? Because all of those things are also concomitant on the continent for people living with HIV. But here's what I know, is that while the door was kicked open by white men that allowed the rest of us to flood in and take our own space in this movement, and then to identify and define it for ourselves, like HIV and reproductive justice for Black women. What I know for sure is that it will be Black women who have to close the door on this epidemic, because we have the babies, because we bring the future, and because we're the backbone of our communities, no matter where we are. And so we're the ones who predominantly affect change once we own the problem. So getting past the stigmas, getting past the fears, getting past the disrespect and the dehumanization and the lack of gender equity in the whole movement space, all of that is a part of ending the epidemic, as much as having access to treatment, as making sure our reproductive health rights and justice are achieved, and making sure that we end gender-based violence and inequity, that all of these are the constructs that are necessary to get to the end of the epidemic, and it's going to be us who does it.
So what's your final words that you want to say in preparation for getting to Botswana and all of these preparatory meetings?
Don't miss not one of them. No, I'm just kidding.
You would.
No, my final is that we are a movement in development. We are building something different. We want to see a global reproductive justice movement, especially led the same way RJ, that's what we call it, the same way RJ has been led, named, developed, shared, right? Mm-hmm. And fought for along other people by Black women. We want RJ in the globe to be led, to be centered with our Blackness and by Black women. And if we don't pull ourselves together to do this in unity, to find and live our solidarity and to grow our power by doing so, then we will not get to the end of the epidemic. And I'll be damned if we are going to be the last to get to the end of HIV when we should be first.
Well, I have to say, we're busy trying to save democracy right now. You think we can end an epidemic too, or where our plate is kind of full?
You know what? I think that as you save democracy, you work your way towards the end of the epidemic. And when you are fighting for the issues that will help us end the epidemic, you are helping save democracy.
Absolutely. Well, thank you, Dázon.
Thank you, Loretta. So let's make sure people know that womennow.world is the website. There will be a calendar of virtual meetings that will be held in all of the major regions of the world, I think everywhere except Antarctica, right? So
unless the penguins request one.
Well, you know, there could be a few people down there that say, hey, what about us? And then we have to think about inclusivity. Mm-hmm. But there will be a virtual summit coming to you sometime between January and October of 2021. And then December 3rd through 5th, we will be gathering in Gaborone, Botswana. And we will also be gathering virtually, and we'll be letting everybody know every step of the way. There'll be lots of information coming out of these virtual meetings, and
Isn't there a kickoff one already planned?
And there is a kickoff meeting coming up January 29th at 11 a.m. Eastern Standard Time, which I think is -5 UCT, which used to be GMT. Y'all know the whole time zone thing better than, you know, most of us in the West do. But in terms of New York time, it's 11 a.m. on January 29th. And in about January 15th, right, we're going to go live with our website. So you'll see all of the speakers that are coming up for January 29th, the conversations that we're going to be having, and the calendar for all of the other regional meetings that are going to be taking place the rest of this year. The other things you're going to be able to find on that website is, over time, information about how to get a scholarship application in, and also how to participate in some of the sessions, how to help us plan, how to give money, how to become a sponsor or a funding partner. All of this information, including some really cool pictures and videos from previous meetings, are all going to be available to you. And I cannot wait until we get to tell the next story of how women of African descent organized to end the epidemic for ourselves and our communities.
Well, thank you.
Thank you. Mm-hmm. And thank y'all for tuning in. Stay tuned. There'll be more.